Back to the 31st Annual Nebraska Data Users Conference. This is our last plenary session of the conference. Following the session, we'll ask you to log into a new Zoom link for our interactive networking session in small breakout rooms. You can go to cpar.unomaha.edu/networking, but we'll give these directions at the end and we're going to provide you the link in the chat. If you are not going to join us for networking, please make sure to complete the conference evaluation available on the conference webpage after this session. As a reminder, controls are at the bottom of your screen. Use Q&A to ask questions at any time during the presentation. With that, I'm pleased to introduce Dr. Barbara Gomez Aguinaga, Assistant Professor of Public Policy and Social Equity in the UNO School of Public Administration, for her presentation, What We Know and What We Don't, the Impact of COVID-19 Among Communities of Color in Nebraska. Barbara is new to Omaha, so please give her an enthusiastic Nebraska welcome. And thank you, Barbara.
Thank you, Josie. And thank you everyone for being here. I hope you have enjoyed all the presentations so far. As Josie said, my name is Barbara Gomez Aguinaga, and I'm an assistant professor at the University of Nebraska at Omaha. And today I'll be talking about COVID-19, specifically what we know and what we don't know about COVID-19 in the state of Nebraska, with an emphasis on communities of color and what can be done to improve the data and health outcomes among these groups. So before we start, I wanted to give you a heads up on what are we going to be covering in this session. This presentation will be broken down into 5 different sections. The first one will provide a general overview of coronavirus COVID-19. Then I will discuss COVID-19 cases and deaths at the state and regional level. Next, I will cover the disparities by racial and ethnic groups with an emphasis in the region and Nebraska. And after that, I'll follow with data availability in Nebraska. And this presentation will close with the importance of data transparency and a series of recommendations to improve the COVID-19 data that is available in the state. So let's start with a quick overview of coronavirus, or COVID-19. The coronavirus disease 19, or COVID-19, can be traced back to December 2019 in the city of Wuhan. And we know that the first case in the United States was reported on January 21st of the current year, and it happened in the state of Washington. After that, there was a cruise, the Diamond Princess cruise ship, that upon arrival to the US, multiple people were infected with COVID-19. And in the beginning of February, the UNMC and Nebraska Med began receiving American evacuees that had been contagious with coronavirus in early February, specifically February 7th. But it was not until March when the first contact case in Nebraska was reported. It happened in Douglas County from a person who had recently returned from England. And I want to reiterate that in early March, specifically March 7, it was the very first COVID-19 case in the state of Nebraska. Today, after 7 months after the first case in the country, there have been about 5.4 million COVID cases at the national level. And here in Nebraska, we have had over 31,000 cases in the state. So now, focusing on the US, here is how the number of COVID-19 cases in the country has evolved. This graph presents a daily count of cases, and the orange lines are a 7-day average cases in terms of cases with coronavirus. So as you can see here, there were very few cases in February after the first case was reported in the United States. And then it started racing up in the second week of March. As you can see here, the first peak that we had happened in April. And after the beginning of April, cases started to go down. However, we had another peak that pretty much doubled the size of the first peak in the middle of July. As you can see in the figure, right now the number of daily cases is in decline. However, it is unknown what's to come. Now, when we think about where are we at the national level, this is a map with the total number of cases across the states in the country, with the darker states meaning that they had more COVID-19 cases reported. As you can see here, states that have made it to the national levels like New York, California, Florida, and Florida are pretty much on the lead. And you can see here that Nebraska is on the lighter side of the spectrum, meaning that we haven't had too many cases. And when we think about where Nebraska ranks in terms of case count, you can see that Nebraska here is highlighted with the light blue. And Nebraska actually is at the end of the tail in number of COVID-19 cases in the state. However, let's remember that Nebraska has a relatively small population, and that is why it is important to analyze data per capita, or the number of COVID-19 cases per capita, or what is the amount of cases that have been reported for every 100,000 residents, for example. And this is where, here is a figure that presents the COVID-19 cases per capita across the states. Again, Nebraska is highlighted with the light blue bar. And as you can see here, Nebraska is within, it's in the top half. In fact, Nebraska ranks 23rd in COVID-19 cases for every 100,000 residents. Now, talking about deaths, here is a map with death counts across the country. Again, the darker the state, the more deaths. And you know, as you can see here, New York is on the lead, and Nebraska again is on the lighter side, with less death counts at large. However, and as you can see here, Nebraska is on at the end of the tail. It's a little bit darker, as you can see here. And Nebraska actually ranks 41 among the total number of deaths. And again, you might think that's pretty good, but we have to keep in mind that we're not the biggest state, and that we have to account for the cases per capita, which is what this figure brings. So here's data about COVID-19 deaths per capita. Again, Nebraska is the bar with the dark brown towards the bottom. Nebraska ranks 33rd in COVID-19 cases for every 100,000 inhabitants. And we all know that the US is quite big, so it is important to emphasize what does that mean for the region we are in, specifically bordering states. And for that reason, in this presentation, when we analyze the region impact of COVID-19, I am analyzing Nebraska, obviously, along with the five neighboring states, including Wyoming, South Dakota, Iowa, Colorado, Kansas, and Missouri. So here is a map with the number of cases per capita in the region, with darker blue meaning higher cases per capita. And as you can see here, regionally, we're a little bit on the darker side, meaning that we have more cases per capita. We actually have 1,500, a little bit over 1,500 cases for every 100,000 Nebraskans in the state. So regionally, we're a little bit high. In fact, regionally, we have the second largest COVID-19 cases per capita. As I was saying, the first one is Iowa, and we have with 1,600 cases per capita, and we have about 1,500 cases for every 100,000 residents in the state. Now, talking about deaths, moving to this data, here is where we are in terms of COVID-19 deaths per capita. So there are about, in the state, we have about 19 deaths for every 100,000 Nebraskans. We're not on the darker side. As you can see, Colorado and Iowa are taking the lead on that in that term. And more specifically, we're kind of in the middle in the region, with Colorado and Iowa having the highest COVID-19 cases per capita followed by Missouri and Oz. In Nebraska, there are 19 deaths for every 100,000 residents. And I want to give you a sense of how severe COVID-19 is, because we know that at large, there are only 2 deaths for every 100,000 people when we talk about the flu, also referred to as influenza. However, here in the state of Nebraska, there's 19 deaths because of coronavirus so far for every 100,000 people. That means that in Nebraska, COVID-19 is 9.5 times more deadly than the flu. Presenting this information is critical because data is very important during pandemics and public health emergencies like this one. Currently, data has been tremendously helpful and useful, not only to understand the scale of the coronavirus outbreak at the national and state level, but it has also allowed us to know how deadly the virus can be. You know, it helped us have a better reference of how much deadly it can potentially be, like the case of New York and New Jersey. But not only that, it also helped us identify vulnerable populations, like who's more likely to get the virus, or who faces the most severe consequences or risks, and why is this effect, like what groups are disproportionately impacted and why. Moreover, data is critical because it helps us make informed decisions. Governments use data to identify policies and measures that need to be adopted and implemented in their territories for prevention, as well as better health outcomes during public health emergencies. And last but not least, data is critical because it helps us keep governments accountable. If the people have the ability to follow what is happening and evaluate our governments based on whether interventions have worked or not, or whether interventions have been developed or not. And today we're focusing on why data is critical for racial and ethnic minority groups during the current pandemic. Here is information about cases per capita at the national level. As you can see, this figure is broken down by race and ethnicity. And this shows COVID-19 cases per capita across the US by racial and ethnic groups. So that means that for every 100 people of each group, how many of them have been diagnosed with COVID-19? And as you can see, Latinos have the largest COVID-19 cases per capita, followed by Native Hawaiians and Pacific Islanders, and then African Americans. Now this graph shows coronavirus fatalities per capita, and it shows that African Americans have by far the highest death rate by a lot, right? So they are followed by Latinos and Asian Americans, and then non-Hispanic whites, who are also referred to as Caucasians. And it is important to mention that the death rate of Blacks at the national level almost doubles that of the rate of non-Hispanic whites. So at the national level, there are prominent disparities in terms of COVID-19 cases and deaths. So let's dig into regional disparities among communities of color by analyzing Nebraska and its bordering states. Again, in this presentation for the regional comparison, we're focusing on Wyoming, South Dakota, Iowa, Colorado, Kansas, and Missouri. So we know that non-Hispanic whites are the largest racial group in the country as well as the region. And this figure presents the percentage of population that non-Hispanic whites represent in their states with the lighter brown bar, as well as the percent of COVID-19 cases that non-Hispanic whites represent also in their state, and it is shown with the darker brown bars. So as you can see, there are, here in the state, 78% of Nebraskans are non-Hispanic whites. and they account for about 64% of the COVID-19 cases in the States. And as you can see, this is a general trend that happens across not only in Nebraska, but also across neighboring states, where non-Hispanic whites are less likely to be diagnosed with COVID-19 than other groups. So that means that non-Hispanic whites are less likely to get exposure to get the virus. Now, this is data for African Americans, and this figure presents the population that African Americans represent in their states with the lighter green, as well as the percent of COVID-19 cases in their respective state with the darker green bars. Regionally, the biggest gap between the population and the share of cases that in their respective state happens in South Dakota, followed by Iowa. In Nebraska, there's about 5% of the population is African American. And right now, they account for about 6% of all the COVID-19 cases in the state. So this is a small disparity, but it's still present here in the state of Nebraska, as well as across the region. Now, this is data for the COVID-19 cases among Latinos, also referred to as Hispanics. This figure presents the percent of the population that Latinos represent in their states with the lighter blue bars, as well as the percent of COVID-19 cases that Latinos represent in their respective with the darker blue bars. And as you can see here, Nebraska has the highest, Nebraska has the second largest percent of COVID-19 cases among Latinos with 36%. However, Nebraska has the largest disparity in the region, because while Latinos in Nebraska account for 11% of the population, they account for 36% of all the COVID-19 cases in the state. So this is a huge double-digit gap. And I ask you to please remember this fact throughout the presentation. The gap in Nebraska is big, and the second worst occurs in Kansas, but it's less than ours. So this figure and these statistics show the importance of reporting data broken down by race and ethnicity during the current health emergency. Now, talking about COVID-19 deaths in the region. Nebraska, as you can see here, the deaths of this figure presents the percentage of deaths, COVID-19 deaths among African Americans, where the light green represents the percent of the population that African Americans account, and the dark green is the percent of cases that African Americans represent in their given state of COVID-19 deaths. So Nebraska here, as you can see here, is tied with Colorado on the largest percent of COVID-19 deaths among African Americans. In this case, Kansas is has the largest regional disparity in terms of COVID-19 deaths among African Americans. What I also want to highlight is the death disparities among Latinos in Nebraska. As you can see here, this figure presents data on the population that Latinos represent in their states, the light blue bars, and the percent of COVID-19 the deaths in their respective state with a dark blue bars. And as you can see here, regionally, Nebraska is the state with the greatest disparity on COVID-19 deaths among Latinos. While Latinos in Nebraska represent 11% of the state population, they account for 22% of the COVID deaths in the state. This is a huge disparity. And in fact, Nebraska is the only regional state with a double-digit disparity on COVID-19 deaths among Latinos. And here's something I want to clarify, because there are misunderstanding why these disparities occur. They come from multiple opinions and points of view, and I wanna bring them out. The first one is political. So there's a belief that Hispanics or people of color are less likely to comply with guidelines to prevent COVID-19. It is a misconception. And there's another misunderstanding that African Americans, especially men, don't wear masks because they can be targeted. And we've actually seen several cases across the country where African American men are targeted or harassed for the way they wear. However, despite these issues, studies have continuously shown that people of color are in fact more likely to take actions to prevent the spread of coronavirus, like wearing masks and practicing social distance. This has been proven in multiple surveys and studies, and I want to clarify this misunderstanding before moving on to data availability in Nebraska. So in this section, we saw that racial and ethnic disparities occur in the US, in Nebraska, and in our region. The disparities on COVID-19 cases and deaths among African Americans exist, and they are even more prominent among Latinos in Nebraska. And we're now going to talk about data availability in Nebraska. In this section, I'll present a brief timeline of important events of COVID-19 events in the state. So in the beginning of February, UNMC and Nebraska Medicine started receiving American evacuees who had COVID-19 from the cruise ship. And they were not from the state, but UNMC and Nebraska Med offered to treat them. After that, the first COVID-19 case reported in the state occurred in March in Douglas County. It was reported in March 6th. So this was the first contact-related COVID-19 from a person who flew back from England, and it was what we identify as the first COVID-19 case in the state. After that, on March 27th, the first COVID-19 deaths in the state were reported. And that same day, the Nebraska Department of Health and Human Services released a dashboard with basic information on COVID-19. Both of these events happened on the same day, on March 27th. And later on, there were news on several cases in the whole county in late April that were related to meatpacking facilities. The Central District Health Department announced that almost 40% of COVID cases in the whole county could be traced back to the JBS meatpacking plant. We're talking about more than 200 people who had been infected with COVID-19 who had some relationship to the meatpacking plant in Hull County. That was one of the most outstanding cases, not only in Nebraska, but also at the national level. A couple of weeks later, Governor Ricketts announced that more than 1,000 COVID-19 cases among Nebraska food processing workers had occurred. That happened in early May. These cases accounted for 1 in every 6 COVID-19 cases in the state at that time. And it is important to mention that while these numbers were not broken down by race or ethnicity, immigrants and people of color account for a very large share of individuals in the meatpacking industry here in the state of Nebraska, as well as the national level. Later on May 14, the American Civil Liberties Union of Nebraska and another organization formally requested the state to routinely provide data categorized by race and ethnicity of the COVID-19 cases and deaths occurring in the state, just like the vast majority of other states had done it by that time. And finally, on June 30, Nebraska started releasing COVID-19 data by race and ethnicity on a regular basis, becoming the second to last state to release this type of information. And here is how the COVID-19 dashboard from the Nebraska Department of Health and Human Services looks like. When you enter the website, this is what you first see. And if you keep digging, you can see the data broken down by racial groups as well as by ethnicity. If you recall the timeline, it took the state a while to start releasing this information. Since the first COVID-19 case in Nebraska, which occurred in March, or which was reported on March 7th, it took the state 22 days to create a COVID-19 dashboard with basic statewide information. Not only that, but it also took 98 days to add data on COVID-19 cases and fatalities by age and gender. 98 days since the first reported case in the state. Additionally, it also took 117 days to release data on race and ethnicity in a routinely manner. And again, Nebraska was the second to last state to release this information. This issue is important because the studies have shown that timely data and data transparency matter a lot for health outcomes and can make a difference in saving people's lives during public health emergencies. And here is a highlight on how data transparency can make a difference. So in this section, I'm going to provide some examples and address why data transparency can make a difference and has made a difference in the state. So here are some examples among the percentages of cases of COVID-19 among African Americans in the state. We know that in the state, African Americans account for about 5% of the state population, as you can see in the gray bar. And we also know that in late May, African Americans accounted for 7% of the COVID-19 in Nebraska. However, as the light blue bar shows, today they account for about 6% of the COVID-19 cases in the state. And I'm using late May because that was the only point where data at the state level broken down by race was published before it started publishing data on race and ethnicity on a regular basis. And this occurs not only among African Americans, but a similar situation happens among Asian Americans in Nebraska. This graph presents the cases, the percent of COVID-19 cases among African Americans in the state. We know that in the state, Asian Americans account for about 3% of the state population in Nebraska, as you can see in the gray bar. And in late May, they accounted for about 7% of the COVID-19 cases in the state. Today, they account for about 5% of the COVID-19 cases in the state, as the light green bar shows. And most importantly, here is the case of Latinos. This figure presents the percent of COVID-19 cases among Hispanic or Latinos in Nebraska. And as the gray bar shows, Latinos in Nebraska account for about 11% of the state population. By late May, they accounted for about half of all the COVID-19 cases in the state. We're talking about 48%. However, as the light orange bar shows, today they account for about 35% of the COVID-19 cases in the state. And while there are still racial and ethnic disparities in terms of COVID-19 in the state, there have been substantial reductions since the data on race and ethnicity started to be released on a regular basis. Again, data transparency during a public health emergency matters, and it matters a lot. Access to timely data during the COVID-19 outbreak can help us in multiple ways. It can help us understand the scale of the problem, including cases and deaths. It can also help us make informed decisions, not only for government and not only governments, but also us as the public. Additionally, access to timely data can help us identify vulnerable populations, in this case, Latinos, African Americans, and Asian Americans in Nebraska. And it can help us improve health outcomes, as we saw in the previous cases. And while the state of Nebraska now has disaggregated racial and ethnic groups, has disaggregated the data on COVID-19 by racial and ethnic groups, there are a few more ways that can help improve data availability for the health and well-being of Nebraskans. In this section, I'll be sharing 3 different ways in which COVID-19 data can be improved here in the state of Nebraska. The first way is to present data on counties by racial and ethnic groups. So this is a screenshot of the COVID-19 dashboard that the state regularly updates. And there is an overview on the number of positive tests or COVID-19 cases by county in the last 14 days. However, it is not broken down by race or ethnicity anywhere in the website. And having information on the composition of cases across counties by race and ethnicity, it's crucial for 2 main reasons, and I want to highlight them. First of all, we have to remember that counties have limited resources to make COVID-19 information available to the public. In fact, only 3 out of the 10 counties with the highest number of COVID-19 cases in the state have information about race that is publicly available in their websites, and it's updated on a regular basis. So having this data at the state level will help counties deal with that burden. Number 2, presenting data by race and ethnicity is important because while data about COVID-19 by race and ethnicity help us understand who is disproportionately impacted, without complete race and ethnicity data across cities and counties, we cannot understand who is most endangered in specific areas. In order to make better decisions, we have to start narrowing down the units of analysis in order to have a better understanding on who's getting COVID-19 cases and deaths. And when we think about counties, I understand the concern of confidentiality across counties, especially because there's a substantial number of counties that have smaller populations in the state. However, providing aggregate weekly or biweekly reports on COVID-19 incidents by race and ethnicity will be helpful to know more about minority groups across counties, regardless of population density. So a solution will be to provide data on counties by racial and ethnic groups, and in order to keep confidentiality concerns addressed, we can aggregate the data on a monthly or weekly basis. So the second way that we can improve COVID-19 data in the state is by providing COVID-19 data, breaking it down by the intersection of race and age. So far, we are aware that racial and ethnic minority groups have been disproportionately impacted by COVID-19. And we also know that age matters in terms of consequences and implications of COVID-19 among those who get the virus. Typically, there are more adverse effects among elderly folks. And I want to bring up that these 2 groups don't have to compete. In fact, We know that the lives of the people in the elderly categories and the lives of people of color are equally important and could be analyzed together. And here is why. So this is a figure from the Centers for Disease Control and Prevention, CDC, that provides health data on at the national level. And it shows the characteristics of people who have died with coronavirus by the intersection of race and age. So as you can see, the bars have different colors, meaning that the lighter the bars, the younger the people, and then they're broken down by specific racial and ethnic groups. Positive bars, or bars going up, mean that the categories broken down by race and age have died with COVID-19 at higher levels. And negative bars going down mean that these specific groups are underrepresented in their relative racial and age group. As you can see here, unfortunately, all ages among African Americans show that they're more likely to die from COVID than pretty much any other group. Among Hispanics below the age of 75, they are all more likely to die from coronavirus. However, as you can see here, if you take a look at the non-Hispanic white group, there is one group that is extremely vulnerable. Non-Hispanic whites over the age of 85 are also overrepresented in COVID-19 deaths in their category. This is national data, and it demonstrates that the intersection of race and age matters. Therefore, the state can gain valuable information to save lives of Nebraskans if COVID-19 data by age and race is publicly available on a regular basis. This will help us identify who are the most vulnerable groups, not only across racial and ethnic groups, but also across specific ages or age categories. And last but not least, another way to improve COVID-19 data in the state of Nebraska is by presenting testing data by race and ethnicity. The state has fortunately moved towards the right direction when it started presenting data on testing. Now, however, the next step is to publish testing data by race and ethnicity. So far, there are only 6 states and DC that collect data on the racial and ethnic composition of COVID-19 testing. And Kansas, our neighbor, is doing it. And besides being a rising trend, providing data on testing by race and ethnicity is important during the current public health emergency. Because it is important to mention that without testing data, we cannot understand the true scale of the outbreak, or whether we're testing enough people, or whether we're testing the right people. Therefore, presenting testing data by race and ethnicity will be something that can be added to continue to improve information about COVID-19 in the state of Nebraska. So now that we've covered a little bit of the overview of COVID-19, as well as racial and ethnic trends in the state in Nebraska, and went through some of recommendations that the state can do to improve testing data, we will move on to the concluding remarks of this presentation. Unquestionably, COVID-19 has changed the dynamics of our daily lives. Just look at how we're currently doing the 2020 Data Users Conference, right? This presentation began by providing a general overview of COVID-19, where we are regionally and where are we at the national level in terms of COVID-19 cases and deaths. We saw that while Nebraska is currently the 23rd state with the most COVID-19 cases per capita, and it is the 33rd state with the most COVID-19 deaths per capita at large, there are important disparities across racial and ethnic groups, minority groups specifically. We saw that within the state, Latinos, African Americans, and Asian Americans have been disproportionately impacted by COVID-19 cases. Additionally, Latinos and African Americans have been disproportionately impacted by COVID-19 deaths. Regionally, when comparing neighboring states, Nebraska has the largest disproportionate impact of COVID-19 cases among Latinos, followed by Kansas and Colorado. And also regionally, Nebraska has the largest regional gap in COVID-19 deaths among Latinos. In fact, we are the only regional state with double digits in terms of that disparity. And while the state has made progress in racial disparities, there is significant work to do to improve health outcomes among all Nebraskans. On the bright side, the availability of data across the country allows us to compare and learn from what other states have done to reduce racial disparities in COVID-19 cases and deaths. So let's remember that the state took over 90 days to routinely release COVID-19 information disaggregated by age and gender, and that Nebraska was the second to last state to disaggregate COVID-19 data by racial and ethnic groups on a regular basis. And let's point out that as data on COVID-19 disaggregated by race and ethnicity has been made publicly available and updated on a regular basis, the racial and ethnic disparities have had some reductions. However, there are multiple ways that COVID-19 data can be improved to continue to inform the public, organizations, and public officials to make informed decisions for the health and well-being of Nebraskans. One of the ways in which data can be improved is by presenting data on counties with racial and ethnic categories. This information will allow us to have more details on where these racial and ethnic disparities exist, and that would allow us to target populations and invest more resources to prevent the spread of the COVID-19 and deaths of the Nebraska population. Second, presenting aggregate data by the intersection of race and age will allow us to understand who is most at risk. As we saw in the figures, African Americans across all age groups are more likely to die from COVID-19. And similarly, Latinos under the age of 75 are overrepresented in deaths of COVID-19 at the national level. However, we know that non-Hispanic white elderly over the age of 85 are significantly overrepresented in the number of deaths of COVID-19 cases. So it is important, we would not know this information had the CDC not broken down the COVID-19 data by the intersection of race and age. So it is important that we learn from federal efforts and we start collecting and making this information publicly available. And last but not least, providing state data by race and ethnicity is important. Providing testing data by race and ethnicity is important, not only because we will join the growing number of states doing so, including our neighbor Kansas, but also because this will allow us to have a better understanding of who is getting tested and whether the cases could be worse or could be less severe. And lastly, I want to point out that access to timely data and quality data can help us in multiple ways during the current pandemic, and it has also been proven that it has helped previous public health emergency. In the current COVID-19 outbreak, access to timely and detailed data can help us continue to understand the scale of the COVID-19 outbreak. As we saw in the beginning of the presentation, we had two peaks. Right now, the number of COVID-19 cases is decreasing, but we don't know what's going to happen next. So access to quality data and detailed data can help us understand the scale of the COVID-19 outbreak if there are any changes, whether they're like more severe cases or they're decreasing. Not only that, but access to timely and detailed data can inform governments and organizations, but also the public. And this is so important because a well-informed public can also make decisions such as abiding rules that are likely to decrease the spread of the coronavirus. And obviously, informing governments and organizations is crucial for successful interventions that will improve health outcomes during the current pandemic. Also, access to timely and detailed data can help us identify groups that are disproportionately impacted by the virus. And at the same time, this information can help us improve public health outcomes during the public health emergency. Thank you.
Barbara, thank you. That was a great presentation. I want to remind everyone to get your questions in. We have some time for conversation before we head over to our networking session. We have a question. Do you know whether age and race data is being collected for COVID-19 testing sites?
I am not aware of that. I know that some other states are doing are collecting data by either race, like 6 states are currently doing, including Kansas, and then they're also collecting data by age. So probably they're collecting this data, but they're not reporting it at the intersection of both race and age.
Absolutely. So lots to dig in. One of the things I was thinking as you were talking, we have seen, you talk a lot about the importance of data to be able to respond to this well. One of the things we saw was, people, different policymakers, different leaders citing, different ways of sharing a statistic. And I think about sort of misrepresenting the data, right? If I sort of flip this around or I do it by a different number other than 100, 100,000 or something else, I can maybe change what it means. Or change, how bad it looks or how good it looks. And I'm just wondering if you have been seeing that, and then why you chose the transformations you did, why that is a better representation of the information than maybe other folks are throwing out with their stats.
Yeah, so what has happened a lot is that there are some claims on the total number of cases or deaths of coronavirus. But we know that that is not the most accurate information. I mean, it is real because there are death counts and there are case counts. However, a better approach, and the approach that I mostly presented, is the number of cases and deaths per capita, right? So that pretty much means that you take or you provide the number of cases that exist within 100,000 people in a specific country. And that has happened, not only at the state level, but also at the national level, at the international level. And while it's very appealing to probably say that the US is the leading country with the number of coronavirus cases, or Nebraska is in the bottom part of the total number of cases of coronavirus, we need better measures, because we know that not all the states or not all the countries are equally populated.
That's it. So building on that, we have a question that in the chat. Nebraska is the only state with a double-digit disparity for COVID-19 deaths for Latinos. Is that true nationwide, or does this or is this just for Nebraska, is that disparity. So the percentage of the population that's Latino compared to the percentage of the population that is contracting COVID-19. We had a big disparity there. Is that true in the US as well?
Yeah, there is some, that is true to some extent. Let me go back to one of the, at the national level, sorry, I hope I don't make you dizzy going with this.
Dizzy with great information.
So I have data on the cases per capita across the US, right? So as you can see here, Latinos are at the national level, Latinos are the most likely group to be diagnosed with coronavirus for every 100,000 people, every 100,000 Latinos. It's in here in Nebraska, and it also occurs in states that have high levels of Latino populations. I don't have it on top of my head, but if you email me, I'll be happy to provide where this data comes and whether it ranks, where the double digits occur at the national level. But regionally, Nebraska is the only state with double digits in terms of deaths per capita, the percentage of deaths among Latinos, as well as that's it among
I
deaths.
think that's the question, and they sent a clarification. They were talking about the region. So within that, why don't we throw up that region slide for Latino population versus the Latinos that contract COVID-19. I love your interactive presentation.
Oh, hold on.
Okay.
I need a way to.
Well, we'll find that. We're finding that. But yes, in the region, we really stood out there too. It was that section.
Here is the region. And as you can
Total
see,
cases per capita, yeah.
This is per capita, and then the bars that are presented are percentages, and this is total population per capita. So we're just talking about everyone included. But when we think about, here it is. Here is the cases of Latinos who had been diagnosed with COVID-19, and other, like Kansas has pretty similar, has a pretty similar trend. It's slightly lower than us, but when the double digit occurs is in terms of deaths, percentage of deaths among Latinos. Okay. So while Latinos in Nebraska account for 11% of the population, they account for 22% of all the COVID-19 deaths reported in the state.
What do you think's happening there?
Well, it is hard to know because we don't have a lot of specific data broken down, but existing literature suggests that while Latinos and other people of color are more likely to follow rules to spread the coronavirus disease, such as wearing a mask or practicing social distance, there are other determinants that make Latinos more vulnerable. First, Latinos, for example, are one of the, Latinos and African Americans represent a very large share of essential workers, right? So we know that essential workers are the ones that are in the front lines, are the ones that have the most exposure to the virus because they're in contact with more people. And while they could be, you know, like wearing masks and trying to be socially distanced, this type of situations like being being essential workers or working in the medical field as assistants or doctors, that they're Latinos or African Americans are not significantly represented as doctors, but they are as medical assistants, that make them vulnerable. And, you know, we also, in terms of deaths, Latinos and African Americans are less likely to have access to healthcare. And while we know that pretty much everyone that goes to the hospital with COVID-19 a very severe case, they will get medical care. Oftentimes, these vulnerable populations decide to not seek the needed help because it can be really costly, and without access to health insurance, they could be even in bankruptcy.
Sure. So someone asked, what sources do you recommend for data about race and ethnicity in Douglas County or the city of Omaha? So, and you talked a little bit about counties in Nebraska, and there are a lot of counties where data is suppressed because of privacy concerns. You came up with a great solution to that problem. Thank you. But here in Douglas County, Omaha, we're a little bit bigger. We do normally report to maybe some of the places you were getting data to be able to show the information you were.
Yeah, so I was able to obtain data on race and ethnicity at the state level from multiple sources. Like one of the most robust source is the COVID tracking project, and that provides data by race and ethnicity at the state level, and it is very comprehensive. It pretty much has every single state except for the only one that is not reporting race and ethnicity, which is North Dakota, but it has pretty much every single count. It is updated every 2 times a week, but it is a very robust data set. It has been backed up by multiple institutions such as Johns Hopkins University. Another one that is very robust is the Kaiser Family Foundation. They have a state and policy action data set to address coronavirus. So they update it less often, I believe every week or every couple of weeks. But it is a good and reliable data set. Now, in terms of the state, obviously there are 2 counties that provide very substantive information. Are the counties that have the largest population in the state, which is Douglas, and the county surrounding Lincoln. They both provide great data broken down by race and ethnicity.
Awesome, thank you so much. Just quick clarification, when you're defining white, do you include Hispanic white or white only?
Yeah, so in this analysis, I do non-Hispanic whites, which is when we think about Caucasians, right? And when we think about racial categories, it's a little bit tricky because, yeah, that's true. On one hand, the vast majority of Latinos by default identify as white, but for this analysis, I am only including non-Hispanic whites. And when I include Latinos, it's all Latinos regardless of their race.
Thank you so much. Okay, so and I think this is a great question. You talked a lot about the impact data can have, and one of the things that you're arguing, and I agree with, is that if we share data, policymakers are going to make better decisions for how to help people. So do you believe the death rate among people of color would be lower if messaging about who should get tested would have occurred earlier rather than several months later?
There is enough evidence to say that that could be the case, right? And we saw this in the state, but we've also seen it in different cases. And it's not just the data, the availability of data itself, it's also the government, state organizations, local and county policymakers, not only making decisions and interventions, but also informing the public.
Yeah, and I mean, I think that, you know, when we're looking at racial or ethnic differences, there could have been different messaging, and maybe not just along racial and ethnic differences, but different occupations, different places, different age groups might need different information to be able, you know, to understand the extent of the pandemic and make good choices. And so by providing just more information, more intersections, right, we could have learned more about where and how people are contracting earlier, and then got information that they responded to, right? I feel really comfortable with the fact that different people respond to different types of information and different people sharing that information. Another question, someone is interested on your take on the CARES Act and if money was being used to address the kind of disparities you identified and other sort of public health concerns.
Yeah, I mean, obviously the CARES Act is has been a good resource for vulnerable communities, right? Because we know that it probably did made a difference in terms of whether you were able to pay your rent or whether, you know, you felt comfortable not going to work for a little bit while the pandemic is happening, if you work in one of these industries that is kind of dangerous, such as the meat packing and food industry. However, I do not believe that it completely alleviates the racial and ethnic disparities, because whether you like it or not, it didn't really provide permanent solution to the health disparities that are occurring. It also is not providing specific support for people in vulnerable conditions. And I mean, I'm not only stating racial and ethnic minorities, but we're also talking about other populations that, you know, work in essential workers, or that, you know, need that resources because they cannot work from home.
One more question. As you were doing this research, other states that did come out early with a lot of data and good breakdowns of the data that Nebraska could be looking to, hopefully not during another pandemic, but to learn more about how to build that capacity to share good data.
Yeah, so one of the states that did a really good job early on providing information and resources was the state of New Mexico. In fact, as you might be familiar, the state of New Mexico has the highest share of Latinos. In fact, Latinos are the majority group in the state. So because of that reason, the governor spent a lot of resources and made sure that the data was broken down by race and ethnicity early on. And in fact, Latinos in New Mexico are one of the only, or if not the only state where they are less likely, a little bit less likely to get coronavirus. So that might be how we can learn about how other states have, you know, targeted communities of color. Success.
Wonderful. Thank you so much for this presentation. Thank you so much for coming to Omaha and bringing this great information with you. We really appreciate it.